So one of the things that became crystal clear very soon in the process is that we did not have the tools, technologies, and methods that were going to be required to solve this problem. And I think one of the coolest things about Carle, Illinois, is that we see those challenges as opportunities for innovation. And that's what we did here. So we've literally made a list, right? Here's all the things we can't do. But if we could do them, we could actually have a really good chance of getting ahead of this and creating a safer space for our students to return. So absolutely top of the list was the test. So when we tried to map it out, it was clear that we were going to need to test everybody. And quickly it became clear that probably twice a week. If you run the numbers, roughly 35 to 50,000 people twice a week, we're talking about an extraordinary number of COVID-19 tests. And the current technology that existed at the time, the test that was available was this nasopharyngeal swab, which we all learned a lot about. This is a very challenging thing to execute on a regular basis on a population scale. There are serious supply chain bottlenecks, costs, and time bottlenecks associated with this. It involves a nasopharyngeal swab, which there were great shortages of these. It has to be put deep into the nasal cavity, which people don't like to do even once, much less do it twice a week for an entire semester or year. There was also multiple steps in that process. You had to use a viral transport medium to convert that into something that could be analyzed further. There's an RNA isolation step that also requires a special kit, reagents, and a machine. And then finally, you do what's called the PCR reaction to look for COVID-19. And so we needed to find a way to eliminate all of those supply chain and time and cost bottlenecks. And this is where we had an opportunity to innovate in a way that could make a huge impact. And so there was early reports that saliva might be an alternative medium in terms of looking at COVID-19. And Paul Hergenrother had the brilliant idea of maybe we could skip RNA isolation and go straight from saliva to the PCR, which would be now very easy to collect. Wouldn't even need necessarily use a healthcare worker. You can imagine doing this on a regular basis, get rid of all the supply chain bottlenecks, drive down the cost, and imagine something that's highly scalable. So we launched a team of those of us from Carle, Illinois, and recruited in many other colleagues as well. And Paul Hergenrother led this extraordinary group of graduate students and postdocs where we went after a direct from saliva to PCR assay. And we called this our Manhattan Project. It actually has been since renamed our Champaign-Urbana Project. And over the course of 6 weeks, from beginning of May to the middle of June, we just went for it. And it was an all-out, full-court innovation blitz. After failing thousands of times, the team discovered a method that allows us to go directly from saliva to PCR. And this is now the COVID Shield test, which has been performed more than 1 million times across our campus and helped keep our positivity rates low and avoided hospitalizations or any deaths while we kept our classes open, our research labs open, and many other key aspects of the university. So I think that was one of the key innovations. There were many others. So the other key issue is data science to figure out who to test, when to test, how often to repeat it. So we were very fortunate to recruit in Nigel Goldenfeld from the Department of Physics and Rebecca Smith from Veterinary College in Carle, Illinois, who together built a team of data scientists and epidemiologists and figure out how do we deploy this fast scalable testing in a way that will maximally mitigate disease spread. And through a brilliant series of kind of epidemiological modeling and strategic decision-making, we were able to figure out a strategy for that deployment, which ultimately proved very effective. The last piece was communication. Amazingly, this turned out to be critical. How do you get the results to individuals fast in a way that's actionable so that the testing can actually be turned into disease spread mitigation as opposed to just ultimately tracking it? And this is where Bill Sullivan and his team at Rockwire very fortunately had already got a lot of momentum towards an app for communication at Illinois to create kind of a safe and effective ecosystem, digital community for education. And they were able to leverage that and pivot and innovate towards this new app, now Safer Illinois, where results from the test could go directly to the user's phone, almost instantly from the lab, as well as opt-in exposure notifications, and most importantly, a access card. So in order to gain access to buildings, they were able to innovate this very cool, creative kind of system in that you have to show your app to gain access. We ultimately called this our do to do model. So we were even trying to innovate in terms of the social science around how to promote compliance and engagement in the testing program. So to do the things that you want to do, you have to do your part. This is the idea. This actually turned out to be one of the most important, I think, discoveries that we made. It's been exported like many other aspects of the program to many other communities. And that has been a key innovation as well. I could list off probably 100 more along the way, but those were the three big ones.